The Global Foundation Network has concluded a comprehensive 5-day nationwide survey on drug and substance abuse among children and adolescents aged 8 to 18 years old. The exercise marks a significant step towards generating reliable, evidence-based data to inform national response strategies on drug abuse among minors. Esther Susanette Bassi has more.
The data validation project, spearheaded by the Global Foundation Network Limited Sierra Leone, was aimed to highlight the scale of drug abuse among young people and supports the implementation of appropriate intervention and rehabilitation programs. Executive Secretary Samuela Grace Coker said the project was about saving lives. It is about identifying victims early and connecting them to treatment, recreationals, and reintegration programs, noting that proactive steps must be taken as soon as possible to secure the future of children.
We are really here to support them and help them and make a difference in the country. So, our plea to the government, NGOs, we need their support and their fund for us to get a rehabilitation center, because that's the only way for us to help them out there, bring them back. Because going out, taking them, bringing them to the rehabilitation center, hiding them away from the drugs is a very good way for us, saving them and helping them back in society.
According to findings presented by founder and CEO of the foundation, Dr. Samuel Coker, a total of 4,025 children and adolescents were found to be engaged in drug and substance abuse across the country. The gender breakdown reveals a troubling disparity. 2,984 boys and 1,041 girls were identified as victims.
And most of these children in the community, they have been deserted by their family. They are now living in the streets. We can't sit back and allow them to die. We have a role to play. We have an obligation as a nation to save this life. And one of the main ways we have to do this is to have a holistic rehab center. A holistic rehab center is a holding center where we have all these children into one side, give them the proper rehab requisite medication. That is the detox, the treatment, the counseling. We come back to the recreational activities, wherein we have these children that are not into academic institution. We get them going to skill training.
Key highlights of the report include 355 school pupils who were discovered to be involved in harmful drug use in 555 schools surveyed nationwide, whilst 3,668 children and teens were recorded as engaging in street-level drug consumption. In addition, the most consumed substance among minors is Kush, a synthetic drug known for its devastating health effects. The Western Area Urban was identified as the most affected district in the country. The foundation has long been involved in anti-drug campaigns and behavioral change advocacy. Over the past 6 years, it has produced impactful video documentaries and awareness content on the abuse of drugs such as marijuana, kush, ecstasy, and cigarettes. Global Foundation Network is now calling for national collaboration to scale up rehabilitation efforts and strengthen protective systems for Sierra Leone's vulnerable youth population. For SLBC News, Esther Susanette Bassi reporting.